All right, so pelvic girdle, posterior aspect of the pelvic girdle, soft tissues. We want to talk about a big picture video of what to think about working on when it comes to all of these soft tissues. All right, so we have the video of all the cascade of techniques. You're going to use those. You're going to do skin and superficial fascia, go into the bony contours, then go into muscle play dysfunctions of perpendicular deformation, unilateral parallels. You have strumming, you have muscle bending, you have all these different options of things that you can do for all the different tissues in this area. So just remember that video, and now we're going to talk about the things that we like to look at as really important whenever we're when we want to treat a coccyx, when we want to treat a sacrum, when we want to treat the innominate from the posterior side, what soft tissues do we need to work on, okay? So to go along with our overall progression, the first thing is coccyx, all right? So with coccyx, what I am feeling typically is when I'm assessing, going down onto the coccyx, and then I'm feeling the borders of the coccyx for a side bend of the body, then I'm feeling, okay, what do the soft tissues feel like in this area? Is it just that the bone is bent off to the side, or are there significant soft tissue restrictions? If there are, then I'm doing a bony contour of the border of that coccyx, and then I'm also doing some perpendicular deformation work onto glute max, onto potentially some of the pelvic floor muscles as they attach there, okay? Then coming up onto sacrum, we have on either side of the sacrum, we have this sacral sulcus. So I imagine doing kind of a bony contour along, along that sacral sulcus on either side. And as we know, that L5 multifidus is like the largest multifidus muscle and really kind of comes down. And so it's this really kind of large area that we need to work on a bony contour of that. And then you can also get on some strumming, and you can do some perpendicular deformation, medial to lateral, lateral to medial, okay? Then from here, we have the actual border of the sacrum, all right? And then along the border of the sacrum, we have all those little hip rotators that come in here. The one that gets the most press, obviously, is piriformis, which attaches from the greater trochanter to the anterior surface of the middle third of the sacrum. But then we have all the other deep hip rotators as well. And so doing a bony contour along the border of that sacrum can help with those hip rotators, can help with glute max as well. And going both directions, going superior to inferior, inferior to superior, and then actually going and working into perpendicular deformation from superior to inferior is kind of the primary probably direction that you want to work. Inferior to superior, you're going to be more likely to compress through the sciatic nerve. So just kind of keep that on your radar as you're working inferior to superior there. All right, so that is working on some of the deep hip rotators along that kind of sacral border. And then we come up and we have the PSIS posteriorly. And so working a bony contour around that PSIS, because as we know with our progression, we need the ability for that innominate to relatively internally rotate or gap away from the sacrum on both sides. And a lot of times there's some soft tissue considerations or restrictions along the bony contour of that PSIS. And then as we move laterally, we have the iliac crest, and we have several different muscles that attach onto the iliac crest. Namely, the deep one is that QL, that hip hiker QL guy, gal, I don't know, that we need to get that to let go so that we can create more space for the lumbar spine, but allow that pelvic girdle to move in the inferior direction, okay? So coccyx, working along sacrum, working along the borders of the posterior aspect of the pelvis are all super important things when it comes to thinking about soft tissue considerations of the pelvic girdle. So I hope this is helpful as you think, what I do from a soft tissue standpoint in this area. This is your video for that, and then you go in deeper and work on all the joint considerations of that area.